Morning everyone, Mr. Brumble here. I want to make a quick video this morning to show you our hospital beds. Here in the lab we have 4 or 5 different types of hospital beds, and sometimes using them can get a little confusing and frustrating to students. So we're going to take a few minutes to go over the different types that we have in the lab and show you how to use them. All right everyone, we have several different types of beds here in the lab. One of the unique ones is here in bed A in the lab in room 120. This is an older style bed, but it's very reliable, oddly. It's called a Hill ROM, and I wanted you to notice several things about it. The controls for the bed on the patient side, if you'll take a quick look at those, you see you've got head up, head down, feet down. A patient does not have access to the height controls, and that's just about on every hospital bed. We don't want them to do that. And notice that you have a call light. Your call light is right up here at the top, so you're not going to have one on a cord. So when you're educating your patient on how to call for the nurse, you need to point that call light out. On the outside of this bed, we have the height control. They are down here, and you notice it's up and down. And then when we lower the side rail, we use this button or knob right here to push in, and the side rail will go up and down. So you need to spend some time here on bed A to make sure you understand how this particular bed works. Right next door to bed A, we have B, of course, because we like to do it that way. This is kind of a newer style bed, and it's made, it's called, if you look down here, it's called a Secure 2. We have several of these kind of beds within the lab, and they work basically the same way. But let's take a look at the controls on the outside. Down here, you notice that you've got a nurse call, you've got an up and down, and several indicator lights. The side rail is controlled by pressing that button down below. Now let's take a look at what the patient has. On the inside, notice that they do have a nurse call light, so you're not going to have one coming from the wall. They can raise up their head and lower their head, feet up and down, and turn on some lights. So that is this particular kind of bed. Again, spend some time on this type of bed. They're throughout the lab, so you know how to use it. We come to bed C, and this is a third type of bed. This one is called an Advanta. Okay, again, a little bit older than the one in bed B, but it works basically the same. Looking on the outside controls, they're arranged a little bit differently. Notice we've got head up, feet down, and then we've got the height control. This one has a built-in nurse call light as well. Right here is a scale that shows you the tilting of the bed. How far, at what angle do we have the head up or down? Every hospital bed has one of these in some way. Sometimes it's down below, sometimes it's on the side, so you have to look around. Inside this particular type of bed, you notice the controls as well. There is a nurse call light here, so make sure you know how to train your patient to use it in that way. And again, this one is called the Advanta. Here we are in bed F, and then this, of course, is a third type of bed. This one is called a Go bed. All right, let's take a look at the controls for this one. Outside controls, you have feet up, feet down, height up, head down, head up, head down. On the inside, the patient controls head up, head down, feet down, and they do have a call light here. So for this one, you won't have a cord coming out of the wall. This one also, to raise and lower the side rails, we use that button right down there, and I'll show you, and then there is your steering, locking and unlocking. Again, another kind of bed that you need to become familiar with. Last but not least, we have a brand new bed that we have on bed I. This one is called the Vantage bed. Much newer, much fancier. Here's your outside controls for the nurse. A little bit confusing. You have to really watch the symbols to see what's going on. There is your angle. That's how you open and close and lower and raise the side rail. And your patient has controls inside as well. My point with all of this is that what I would like you to do is to go around the lab and spend some time with each of these. I'm giving you kind of a tour of all the various kinds of beds that we have here in the lab. I know this is confusing. It's a lot of new information, but I really want to encourage you to go around and check out each and every one of these beds. I've given you the numbers. You can see the various kinds. It's really awkward when you're doing your checkoff and you don't really know how to use the beds. So make sure that you spend some time and check out and make sure you know how to use each and every bed. Thank you very much. Look forward to seeing you in the Skills Lab soon.